cardiac drugs or medications has a specific action and a profile of side effects. So it is very important to stick to the prescription that you have been provided, especially the name of the drug, the dosage of the drug, the timing of the drug. All of these have to be followed as closely as possible. Skipping your drugs is not a good idea because it can lead to complications. It can lead to recurrence of heart attacks and also to other issues like heart failure, arrhythmias, and further complications. So I think sticking to your prescription as closely as possible is very important when it comes to heart health. Occasionally, our patients do tell us that, doctor, we have missed a dose, we have forgotten to take our pills, is it okay, and what should be done, and so on and so forth. If this is a rare occurrence, it is okay, it is not a problem. But if you are missing your doses frequently and you see there is a repetitive pattern, or if there are some side effects and so you are not able to take your drugs regularly, you have to bring it up to the attention of your treating cardiologist or physician. In case you missed a dose in the morning and you remembered a few hours later, it is still okay to take that dose. But if it is almost the time for your next dose, which is like maybe in the evening, then you can just skip that previous dose and take your next dosage as prescribed. But if you see a repetitive pattern and more often that this is happening, this definitely has to be brought up and changes should be made to your prescription as necessary. So when it comes to heart drugs, the short-term drugs are mostly aiming good control of your risk factors. For instance, it could be your hypertension, it could be your blood sugar levels, or it could be your cholesterol levels. So we want all these risk factors to be under control. These parameters, these numbers should be as close to normal as possible. So taking these drugs on a daily basis is very important. But there are also longer-term drugs such as your blood thinners or drugs to keep your atherosclerosis low. That is, plaque formation should not happen. There should not be extra thrombosis or blood clots in your cardiac vasculature. So you want to take these other medications on a longer term basis. So as I initially said, all of these drugs do have a specific action. So it is important to stick to both your short term and your long term meds as prescribed. As somebody who has been prescribed cardiac drugs, or for that matter any other drugs, you have the right to know the science behind your disease as well as the reasoning or logic behind the medications. So understanding the importance of each and every drug is crucial in actually sticking to those regimens. So it could be a regimen for a few months or for a few years, but once you understand the basic mechanism of action of your medications and also what are some side effects that you could expect, because all of these medications do come with some side effects. So we know that internal bleeding can be a side effect of blood thinners. And when you take diabetic medications, you could go into very low blood sugar or hypoglycemia. So all of these side effects should also be, you should be aware of. And it is important to keep your own personal health tracker or a medical diary or some sort of digital or hard copy or some tracker where you are documenting on a regular basis any changes that you notice, and so that you can bring it up to your healthcare professionals when you actually meet them and discuss it in detail. So as a preventive cardiologist, my tips to all of you to preserve and to take care of your heart health would be to follow a healthy lifestyle, to stick to your medications and your doctor's follow-up advice as closely as possible, and to follow a preventive lifestyle or a cardiac rehab program as needed for your health condition.